Miami Community Health. Again, another interesting show we have for you. And as you know, March is Nutrition Awareness Month. And we obviously know that what you eat is what you are. You are what you eat is what they say. So what none better than bring to you a nutritionist, a dietitian, somebody who has dealt with nutrition for 30 years in working with those patients who need advice for nutrition. We have Sabrina Hernandez with us today. Sabrina, welcome.
Thank you, doctor. Thank you very much. And thank you also for the work you do.
All
Patients
right.
love you.
All right. Well, thank you. Well, what she's mentioning is we work together because, as you know, part of my practice is bariatric surgery. And Sabrina sees our patients before surgery and after surgery as well. And as we'll talk about, bariatric surgery is not the solution for it all. Correct eating is very, very important. So first, why don't we just tell us a little bit about yourself, Sabrina?
So I'm passionate of nutrition, education. I love what I do. I'm finding myself doing it all day long now, more hours than ever. I'm working in private practice for myself. I have my office right down the street from here, Hummingwell Wellness. And I have to say that I've been reflecting a lot, I guess, within the last year about the legacy I think that I want to leave before I actually retire. I've had a beautiful career. I have worked for big pharma. I have worked for big hospitals, like Baptist Hospital. I've worked for the food industry. Actually, they hired me straight out of school to promote orange juice, Coca-Cola company, actually. So I've had a beautiful career, but all throughout my 30 years, I've somehow just been able to educate and do private practice on the side, even having my own home office at one point. Wow. Because it is my passion to counsel and to help people get to the core of what really is it that nourishes them, not just the plate that they put in front of themselves, but what are they actually nourishing themselves with? I think it's a question of education, physical, of course, mentally, spiritually, and most of all, I'm finding emotional. I think people are emotional eaters. I've been able to sort of see the distinction between addiction and actually anxiety. So I see that when people are anxious and they have that trigger for possibly an addiction, they tend to not even realize that they overeat. So if you're angry, if you're lonely, if you're tired, if you're bored. So I've been doing a lot of really cool work and helping people just come to their own realization that it's not about the diet you're having. It's not about the food you're eating. It's about the choices you're making because of the way you feel. So I'm having a ball. I'm having a good time.
That is great. So it's great that obviously we have a dietitian and nutritionist who understands that it's much more than just the food and obviously their psyche. So obviously obesity is something that is growing in our country, growing worldwide. What are we going to do about this obesity epidemic that we have?
We are actually going through a terrible, terrible time. I think that if COVID is in our face and we know it's a pandemic, we are maybe hiding the fact that this year alone, 90,000 people will die from cancer related to obesity. It's 190 million, I think, or billion. The numbers are so high that they get confusing. But this year alone in healthcare, we will be, I think I wrote it because I'm like, between millions and billions, it's a little tough. Billion. It's 190 billion in healthcare cost yearly because of obesity. So we're seeing diabetes run rampant. And I don't call pre-diabetes. A patient comes to my office and tells me, my doctor said I have pre-diabetes. And I said, pre is just going to lead you to 5 years of doing nothing. And then you're going to end up having the consequences of having diabetes. So strokes. I had one of those during COVID in my office. I didn't have the luxury to close my office because I pay my lights, I pay my building. I actually don't rent. I bought my building. So I had to keep open. And the atrocity I saw 15 to 20 pounds. I actually took all my charts and I did the average count. So there were 15 to 20 pound increase during the 1 year of COVID. That includes gastric sleeve patients as well. So there is going to be in the year 2030 a serious issue said by the Surgeon General back in the day from a conference that I went to about 10 years ago. And that still lurks me because in 2030, we will see adolescence, which is so painful because that will be the children of our children having obesity. They will die younger than us. Our generation may live well into our 80s and maybe 90s, hopefully 100. My dad's 96, for example. But our children, their life will be cut short because of the craziness that we are having with the messages that are coming to us on a daily basis, which leads us to make decisions about food that are absolutely ridiculous. We are really going to die sooner, younger. So obesity is a huge, huge crisis.
So obviously it's something that we have to get our hands around and kind of control. And is the environment, the food environment, this McDonald's, this supersize, bigger packages, buy one, get one free, 2 for 1, that environment is toxic for us, isn't it?
And that I want to bring awareness to. The industry is so large and so mammoth that they don't want to be blamed. Nobody wants to be blamed. And we definitely, as educators and doctors and in the healthcare field, don't want enemies. So we definitely don't want to point fingers. And we have to ask the question, whose fault really is it when you drink a mega gulp? So a lot of times I tell my patients, well, they're very expensive. And, that my first degree was fashion merchandising. I was a kid when I studied that. But it's interesting that there are shoes out there that cost maybe $1,000, $2,000. People buy them. They have money to buy them, right? And I ask the same question. If you have the money, and you want to wear them, and it's your prerogative to spend your money that way, with, let's say, Big Gulp or Mega, if you're a runner, if you're an athlete, if you're going to burn it tonight when you go home and run for 2 hours or, 18, 20, whatever, 30 miles riding your bicycle, who's to tell? So the government is saying, wait a second, why are we responsible for people's choices? People are saying, please do not police my food. If I want to buy Valentino shoes, which are, $1 million or whatever, if I want to eat the Big Gulp and the Whopper and the Mega, let me do it. So we have to be careful as to how we tread this one. There's someone who just wrote a book who's getting all kinds of, I think it's called Food Politics. And she's, of course, a professor in education. And she's getting all kinds of, she's even getting threatened by the sugar company to be sued. So when we talk about these things, we tread lightly. And we say, what, we do not want to make enemies. We want to bring awareness. And we do want people to have choices. So you don't want your kid to never know what it is to eat an ice cream or to go to McDonald's, right? But are we educating them about what is in the label? How often? Is moderation, variety, and balance really just something that sounds too boring to really spend? What is it that the industry can spend $250 million on promoting a single product? Moderation, balance, and variety is so boring. It's not sexy. And it's just, I've been in it for 30 years and I couldn't have my private practice. No one would support it. No one would say, let me give you funding so that you can open up a private practice and talk about education. You have to remember that 30 years ago, what I was doing was called quackery. They would say, are you kidding me? Don't practice medicine. I'm like, I'm not practicing medicine. I'm just helping you not have a heart attack. And it starts with me telling you about your LDLs. And my doctor told me I could say it. And I'm under the umbrella of the American Dietetic Association. I'm under the umbrella of medicine. We are your right hand, if you will, that will help you help your patient. So with the industry, I think we have to say they're going to make money. They're going to want to make money, and they do good things. They sponsor all kinds of, programs, and they do things with their money, hopefully that is responsible. So we're not going to change that. It's $1 billion industry, and we're not going to silence them because we say that balance, moderation, and variety is important. They're going to win every single time. And that's okay. But then we have to ask ourselves, whose responsibility is it on what you ultimately put down your throat?
Yeah, no doubt about that. And I think that obviously it begins with prevention, right? Prevention in yourself. A lot of people that are watching us and listening to us today may not be obese. They may be a little bit overweight, but preventing. And if you are not obese, of course, preventing it and teaching your children in your household. So, are we doing a good job at preventing obesity? What can you do as a leader in your home, the family unit, in educating yourself, your family, and your loved ones about preventing obesity?
Children are watching what we're doing. If we're buying the cookies, sometimes a patient will say to me, well, I can't get my kid to stop eating those cookies. It's like they're addictive. And I'm like, well, who bought them?
Who drove to go get them? Yeah, that's correct. Yeah.
And, are you eating them? Of course I'm eating them. I'm watching them eating them. And of course I'm going to eat them. So, I say, we need to make changes that are small, but impactful. So when was the last time you brought home maybe, fruit? Are you buying fruit? Are you buying vegetables? Are you offering your child, mini baby carrots versus, cookies and crackers and all kinds of, stuff that ultimately will become addictive to their brain, and they'll want more because there is a pathway. We know there is a pathway that is the one just for heroin and addicts to say, I want more. Oops, I'm not getting enough. Let me have more and more. So these children that are getting exposed to all this sugar, what's happening is that they're saying, wait a second, you gave me sugar. And I think I'm needing more of that sugar. And now I want more of that sugar. And before you know it, you have somebody who's actually craving the sugar. So I think education is so important, because when I teach my patients, how much sugar can you have for the day? And make yourself happy. If you love sugar, have your quota, but have the right amount. It's like getting the right shoes when you can afford them, so that you're not in a tremendous crisis with budget. I tell them, you have a budget and you can use it however you want, and not 2 days are the same. So everybody who starts out by saying, I'm going to start my diet on Monday, I'm going to eat super clean, I'm going to eat all vegetables and fruits. Well, that just lasts as long as you're invited to somebody's house, or over dinner, some place, or over to a restaurant, or when the first trauma in your life happens, or, just an emotional day, you're going to say, forget that. I'm just going to eat whatever I want, and dive into usually the worst thing you can find. So we need to tread slowly. We need to say, if I've been having a lot of sugar, I always think of it as levels. I'm like, how toxic is your real world? I mean, how much sugar are we talking about? How much soda? And of course, a lot of times you can tell by the way somebody weighs. So yesterday was an incredible day. I started off my day with an athlete, and I ended up with somebody who had gastric sleeve surgery, whose fat mass alone was 278 pounds.
Wow.
And that's just another show. But I think that we should be mindful also about, where we're at. We need a good assessment. We need to really put a few pointers together. What is my cholesterol? What is my hemoglobin A1C? Understand that that's the average of the last 3 months. It's not just when you measure your blood sugar. So you need to know, what has my behavior for the last month been with sugar? Right. Let's measure your A1C. Let's take a look. Let's see how much girth around my stomach I have. What is my waist circumference? And then from there, we tailor individual behavioral changes. So like you said, doctor, if you're looking at someone who needs to maybe lose 5 pounds, very different than somebody that needs to lose 20, or somebody that needs to lose 200 pounds of fat. Very different. So where are we is, I think, the real question. And then how many changes do we need to have? So for a particular patient, I may be saying, listen, I think that if you increase a little bit more of whole grains because you just did 30 miles on your bike and you feel a little tired, versus, we need to stop drinking, 3 liters of Coke a day. So there's just, where are we is the real question, Where are we?
Yeah, I mean, one of the things you mentioned there, which I see in my patients, is the addictive nature of food and the addictive nature of sugar, and even things like caffeine in the sodas as well. And so let's talk about that, the addictive nature of food. I tell patients it's easier probably to stop smoking and stop drinking than to, control your eating, because you need to eat to live. So it's a necessary requirement, but you don't need to smoke to live. You don't need to drink any alcohol to live. So, is food addictive? And are there other foods that, sugars and everything else? I see these patients with the Diet Coke addicts as well. How do we deal with that?
Well, there's a lot of research, a lot of money being spent nowadays on how addictive is sugar really. And if they conclude that sugar is really addictive, how they think that they're going to bring it out, imagine it's going to be like almost tobacco smoking. So when tobacco became a thing and they wanted to help people stop smoking, they said, let's target the children to help tell their parents to stop the smoking. So that works. That works because kids know that the excess of this tobacco use will kill their parents, and we're not going to have parents for long term. Mm-hmm. Same thing with the sugar. If sugar becomes clearly a food that is said, science says that it is truly addictive, and you can't advertise to children like you're advertising to them now, because it's a serious problem. So let's get the children to start talking to the parents and actually say, listen, why did you buy all this sugar for me? I'm only allowed to have a certain amount of sugar before my body starts going crazy and causing health issues. That's because the kid learned this in kindergarten, in first grade, in second grade. And then the kid is aware, Mom, if I have more than 6 of these, I'm going to have a serious issue. So, moderation becomes a real thing. But the addiction factor is not proven 100% yet. But we do know that the science is saying and looking into that direction, where there are pathways. There are pathways where when you give somebody drugs, they become almost like dependent on it. And then there's a threshold, and then they want more. And there was an interesting research with one of, I guess, America's favorite cookie, and the actual real drugs, that it triggers in the same part of the brain. So interestingly enough, I've had clients over the years tell me, I cannot bring that home, because I've told them, hey, how about moderation? Let's have 2, let's have 3. And they're like, have you ever been an addict before? Do you even understand what you're saying? Just knowing that they're in the cupboard. So one lady once told me, and I still work with her. She's been my client for years. And she said to me one time, I actually put it in the freezer and it didn't work. I almost broke a tooth just going right through it. So the addiction is a real thing. I believe science needs to come out and really 100% say, this is what we have, and not just junk studies. Remember, we have studies that are out there that are mini studies so that you can put a label, like, for example, I love this one. This is my favorite. I'm having so much fun with the industry lately. So I've seen products that say vegan, organic. And, my teens bring it in and they're like, look, I'm eating this. It says vegan and it says that it's organic. Am I eating the right thing? And then I look at it and it's got enough saturated fat to kill you on the spot. And not because I said it, because 2020 did a huge piece back in the day about how one large fatty meal can actually give you cardiovascular disease in a very quick moment there. So, and of course, we know that increase of fat in one sitting is not good for your body. It can't be, right? Just like sugar. So we have to be careful with the labeling and really understanding what the label says and how much you need. And again, if you're out there walking and running every day and you're exercising, you have a little more leeway. You can actually eat a little more and it not be an issue anymore. The reason that I think weight on the body becomes an issue, it goes way back. It's so prehistoric. So back in the day, millions of years ago, I guess, thousands of years ago, there was a scarcity of food. So we taught our body that we would eat and eat and eat to have this amazing machine that we are, store this fat around our body, especially our liver. And I have this amazing machine in my office that I'm having a great time with, because I ask people, do you have any idea what your visceral fat is? And they're like, first of all, what is visceral fat? Visceral fat's the fat that's around your organs. It's your liver, your heart, that when the poor surgeons have to go in there and find your stomach, they have such a hard time, getting to, because you have so much of it. So I measure visceral fat in my office, 13 liters. It's measured in liters. So I tell people, those 2-liter bottles of family soda, you have 5 of these in your body. You have 3 of these. You have 2 of. I should have brought the visual, because it's so impactful to my patients. They're like, how do I get rid of that? I'm like, well, you actually told your body that you were going to be hiding in a cave, and there was going to be a snowstorm, and there weren't going to be any berries for you to eat. So you were going to just eat and store and store. And when you couldn't store it anymore around your legs and your abdomen and your arms and your neck, we were going to go to the liver, because you were going to be locked up in that cave for months. And so that's not what we're having right now. What we're having right now is an overabundance of food, and lack of movement. I mean, we're not hunting for our food. We're not opening up that cave and saying, let's go run for that tiger or whatever we're going to eat, that lion, whatever. I don't know what they were catching our ancestors back in the day. I love animals. So it would be very hard for me to even imagine what animal they would be going for.
But even going out to get the crops, exactly. and cultivating the crops. But you're exactly right.
To catch one of those animals, you'd have to be running a lot for days sometimes. So that is not our reality. And we have failed to teach our children that. I think we have failed to teach our mothers who are pregnant, who have babies in vitro, that I'm seeing, and I'm saying, oh, you are eating way too much. I know you have another human inside of you, but there's no way you need to be eating 4,000 calories. You're going to end up having diabetes,
gestational diabetes, correct? Yeah.
And all kinds of preeclampsia and all kinds of issues. So I think the problem is again, how many calories are we really putting in our mouth? Do we even know about our budgets? We all have a budget. Mm-hmm. Everybody has a budget. And I go back to my athletes. If you're a runner, your budget's going to be a lot higher. Yeah. It's like people who make a lot of money. You're going to be able to spend in fancier, more expensive things. And if you don't, you're going to have a credit card, and you're going to start accruing, and then you're going to become, budget problems where you become bankrupt. I think obesity and bankruptcy go hand in hand. I think it really does.
Bad choices. It has to do with bad choices.
Or too much excess. Yeah. So I think budgeting, planning, and making good choices is a clever idea for the new diet, because I just laugh every time I hear the newest and greatest, the beauty diet. And
we're going to get to those diets. Yeah. So before we get to the diets, let me ask you. So we have a patient who's an addict to sugar, addict to caffeine or Coke, or how do they stop that? Do they stop at cold turkey? Because you talked about moderation, and a lot of my patients, like you say, they can't have it. They can't have it at the home because they're thinking about it and it's there. So just like you told that parent, how is it that kid eats that cookie? Well, it's not that the kid drives over to Publix and gets it. The parent has to buy it. So should they stop that sugar cold turkey? Should they eliminate everything cold turkey, the Coke cold turkey?
Been there with different types of people, different types of patients. It's a team approach. Some people are easy. Some people, you will tell them, I find from my expertise here and from our experience together that you may have an addiction to sugar. Would you be willing to stop? And they'll clearly say, I can, I will, and I will never look at it again. And they're so successful. Then you have people that try so hard, and they have a psychologist, and they have a psychiatrist, and they have their medical doctor, and they have their registered dietitian, and they have their trainer, and they still have a moment of weakness and just fall back. And they have their groups. I love the community groups that help for addiction, of overeaters and all that. So I think it depends on who you are, how bad in trouble you are. Recently, that person that I told you, that struggled during COVID and ended up having a stroke. There's nothing like hitting rock bottom to really forcing you into making changes. So somebody who gets told they have diabetes will be more likely to say, I think I'm going to stop, the sugar. So when you have the actual addiction and you do have somebody with addictive personalities, I highly, highly recommend to work as a team. I need the psychiatrist involved because sometimes they do need medication. I work with the psychologist because I do need for them to address the issues of maybe sexual abuse, marriage abuse, verbal abuse, even work abuse. People are in jobs that they hate. I think the biggest blessing, besides the fact that my parents were brought me to be born in this country and flew communism, is really the fact that, that I was really, nurtured in a way and was able to study and work in what I love.
Yeah.
How many people do I sit down on a daily basis that tell me I'm miserable and I'm overeating because I hate my job? And I'm like, well, let's get you out of that job. I think I'm more responsible for people changing jobs and getting divorced than any other profession, because I really sit there and I tell them, do you really believe that, this addiction that we're talking about, this crazy way that you're eating when you're angry, tired, bored, lonely, what is it causing it? Is it your family? Change your family. Change it. Get home one day and say everybody is responsible for themselves. I'm not going to cook. I'm not going to clean. I'm not going to wash 5 loads of clothes. I'm going to go to the gym. When your kids and your husband, or vice versa, when your wife and sees that you are going to the gym and you're going to love yourself and you're going to take care of yourself and you're going to come back calm and you're going to have a nice plate of food, it's a game changer. Yeah. But when people are miserable, they're going to eat miserable. I tell people, your plate looks like what your life looks like. So, and again, I'm a huge foodie. My sister has 2 restaurants and my mother is a chef. She cooked for 40 years, to make ends meet. So I love food. I'm passionate about food and I eat absolutely everything. There's not a food that I don't eat. I just am very careful about the numbers. For example, if there's a sweet, delicious, something with a lot of calories, I will be mindful about it. I will think this is going to be eaten very slowly. I'm going to enjoy it to the very last teaspoon. Maybe I'll eat half and save the other half.
I was going to say, you don't have to have all of it either.
Exactly.
You could just taste it.
Exactly. So if you're not a full-blown addict, I think that you can have responsibility for budget and numbers and see a registered dietitian. I have amazing colleagues all over Miami, all over Fort Lauderdale, all over California. Registered dietitians are easy to find nowadays. You just go to the academy and you can find one in your neighborhood. And finally, people want to hear about education. So you can find a registered dietitian just about anywhere, especially in the hospitals. And I've trained a lot of these dietitians, obviously, since I've been around for 30 years. And I tell them, you know what? If you really want to practice medical nutrition therapy and you really want to counsel your patients, number one is you have to have a good relationship with your patient. You have to understand where they're coming from and do not treat them like the latest diet. People are individual. So when people talk to me about 100 different diets, I'm like, what is your preference? What is your diet? What is going to make you happy? What is going to be aligned with the way that socially, culturally, physically, mentally, spiritually you like to eat? It's about individualism. So I have a big bone with diets.
So that's what I want to talk about. Let's talk about diets and what is the best diet, because today, it's all keto, a lot of keto diets. We went through the Atkins diets years ago. Every year when I see January come around, Weight Watchers, always the best diet to lose weight. So what is the best diet, or what is the best nutritional plan? A lot of people say a very balanced plan is the Mediterranean diet. Absolutely. As well. So tell us, should we all be on the same formula, on the same plan? Should everybody be on the same diet?
Well, you know what? It doesn't work. It doesn't work. It does not work. It does not work. People adopt to whatever they're comfortable with. So I have a patient that'll be like, oh, I'm doing keto and I absolutely loved it. I have lost so much weight. And, I have gastritis and I'm really constipated. So
Yes.
then I address the issue. Wait a second. Let's talk about this keto diet. Do you think you'll be able to sustain it?
Yeah, maintenance.
Talk to me about the side effects that you're experiencing with this. And some people, just tell me, look, I tried it. I lost weight. I couldn't sustain it. So I'm gaining the weight back. So extreme diets have always been a thing. They go back. There are actually documented 17,500 diets.
Wow.
Yes, I loved that. I heard
I thought there was only 17 diets,
No.
but there's 17,000. Okay.
Yes, the first one was actually the very first diet in history was alcohol. It was a guy that said, I'm overweight. I need to ride my horse and I'm going to drink alcohol. And he definitely lost the weight, probably died too.
Probably fell off his horse a couple
Exactly.
times, I would imagine, right?
So the history of diet is a beautiful one. And we can speak about them for hours. But what I've noticed in the last 30 years is that they're recycling, and it is probably over $100 billion industry. Of course, because keto is a thing now. It's driving the sales of keto products incredibly, and it's amazing. Billions and billions of dollars. People are buying everything that says keto, and they don't even know why. When they bring me food items that they've bought, I'm like, why did you buy this? And they're like, because it said keto.
Yeah.
So then, a keto, of course, is a modified sort of Atkins. The real keto is a diet that was actually made for epileptic children, in the 1950s. So it's a diet that really talks to your body, which is scary. It tells your body to do something, and it targets the brain to actually make changes on the way you metabolize food, which I tell people, tread lightly, because you may be in big trouble if you do something that is radical to your body for a very long time. I mean, us humans need macronutrients no matter what. We're going to need carbohydrates.
Yeah. We need all components.
Exactly. Yeah. Not too many. But what is sustainable for people is what I really like to ask them. And if you are a social being, you will learn quickly that keto becomes a problem. How do you go out and have a good time? It makes it more difficult. Yeah. I mean, people do it.
I've heard that there's keto wine.
There's keto everything. There's keto dietitians. Anybody that will nowadays, if it has keto attached to it, it has a price tag attached to it. I promise you that it's
the most expensive,
because people want things that work, and we're desperate. What happens is that we become desperate. So if I tell you that the soup diet, sometimes I have so much fun with my clients. I tell them, oh my goodness, haven't you heard of the latest diet? And they'll look at me and they're like, what is it? What is it? I'm like, it just promises to make all your dreams come true. You're going to lose 100 pounds this year. And they're like, what is it? What is it? What is it? And then, I just laugh and I'm like, really? You're a serial dieter and you want another one? How many have you done? And then usually the bigger people are, they'll tell me, well, it goes back for years. I've done Atkins, I've done Mediterranean, which Mediterranean is a very balanced.
Yeah, very balanced.
You eat healthy fruits and vegetables. You're going to eat the good fats. But that also, anything that you do in excess and too much of is going to get boring and tired. So it's almost like getting into a groove, understanding how many calories you need for the day, maybe experimenting, seeing what works for you. Have you ever had, salads or salads is just something that you didn't grow up with and you're never going to have them? Do you even like vegetables? People have food preferences. Some people have cultural and trendy thoughts on food. So
or even social preferences as well.
Lately I've been having my, some of my teens come in and they're like, I am a lacto-ovo vegetarian, vegan, and pescatarian. And I'm like, well, let's go for it. What does that look like for you?
Well, you can see that this is complex. The analogy I would make here is that, trying to create your own diet and your own meal plan and your own nutritional plan is like I'm trying to operate on myself. That's complex. So you need a professional like Sabrina. And we've learned, obviously, that the obesity epidemic is huge. It's killing Americans. I always quote that we have 300,000 deaths a year in the U.S. caused by obesity, not only by the cancer, but also the heart disease, the cardiovascular disease, the strokes. And we know that we're fighting huge organizations, huge companies that are trying to make bigger sales. So it's not simple. There's not one single diet that's going to solve it for you. seek a professional like Sabrina. And I want to thank you for coming with us today. Our time is up today, and it's such a great, interesting topic. And I want to thank you for coming, just touching on the top, just the tip of the iceberg about what obesity is and what appropriate nutrition is. And as our viewers can see, it takes a lot more than just trying another diet. It takes a professional like Sabrina, a good dietitian, a good nutritionist to give us the good information and kind of help us design the correct plan for us. So thank you once again.
My pleasure.
All righty.
Thank you very much.
Once again, from our studios here at Miami Community Health, thank you for being with us on another important health topic.